Every video on this channel moves you one step closer to a government nursing job, improves your nursing knowledge and bedside skills. Watch till the end, learn something new today, and contact me using the WhatsApp link in the description below for exam ready PDFs. What does the T wave represent in an ECG? A. Atrial depolarization. B. Ventricular depolarization. C. Ventricular repolarization. D. Atrial repolarization. Correct answer C. Ventricular repolarization. The T wave represents ventricular repolarization, which means the ventricles are relaxing and resetting after they finish contracting. This resetting prepares the heart for the next heartbeat. Which ECG segment represents the time between ventricular depolarization and repolarization? A. PR interval. B. ST segment. C. QT interval. D. TP segment. Correct answer B. ST segment. The ST segment reflects the period when the ventricles are fully depolarized and before they start repolarizing. It is normally flat, and any elevation or depression suggests myocardial ischemia or injury. Which part of the ECG represents the electrical activation of the atria? A. P wave. B. T wave. C. U wave. D. QRS complex. Correct answer A. P wave. The P wave shows atrial depolarization, meaning the atria are contracting. It appears first on the ECG because atrial activation occurs before ventricular activity. Which abnormality is suggested by a prolonged PR interval? A. Atrial fibrillation. B. First degree heart block. C. Ventricular tachycardia. D. Hyperacute T waves. Correct answer B. First degree heart block. A prolonged PR interval means the electrical signal from the atria to the ventricles is delayed. The delay is characteristic of first degree AV block and is usually identified when the PR interval exceeds 0.20 seconds. Which condition is most commonly associated with a tall peaked T wave? A. Hypokalemia. B. Hyperkalemia. C. Hypocalcemia. D. Hypernatremia. Correct answer B. Hyperkalemia. Hyperkalemia alters ventricular repolarization and produces tall, narrow peaked T waves on the ECG. This finding is an important early clue for high potassium levels in critical care. Which finding on ECG suggests atrial fibrillation? A. Regular rhythm with tall P waves. B. Absence of P waves with irregular rhythm. C. Sawtooth flutter waves. D. Wide QRS complexes. Correct answer B. Absence of P waves with irregular rhythm. Atrial fibrillation shows no distinct P waves because the atria do not contract in an organized pattern and the rhythm becomes irregular. This is the classic ECG hallmark of atrial fibrillation. Which ECG change is typically seen in myocardial ischemia? A. ST elevation. B. ST depression. C. Tall U wave. D. Short PR interval. Correct answer B. ST depression. ST depression commonly indicates myocardial ischemia because reduced blood flow to the heart muscle affects ventricular repolarization. This change is especially seen during exercise stress testing or episodes of reduced oxygen supply. Which finding suggests a complete heart block on an ECG? A. Prolonged PR interval. B. P waves with no relationship to QRS complexes. C. Short QT interval. D. Tall R waves. Correct answer B. P waves with no relationship to QRS complexes. In complete heart block, the atria and ventricles beat independently. So P waves and QRS complexes appear without any consistent pattern. This loss of coordination is the hallmark of complete AV dissociation. Which rhythm is identified by a rapid, regular, wide complex tachycardia? A. Atrial fibrillation. B. Ventricular tachycardia. C. Sinus tachycardia. D. Junctional rhythm. Correct answer B. Ventricular tachycardia. Ventricular tachycardia presents as a fast rhythm with wide QRS complexes because the impulses originate from the ventricles instead of the atria. This rhythm is dangerous and can quickly lead to cardiac arrest if untreated. Which interval on the ECG represents the total time for ventricular depolarization and repolarization? A. PR interval. B. QT interval. C. ST segment. D. TP segment. Correct answer B. QT interval. The QT interval measures the beginning of ventricular depolarization to the end of ventricular repolarization, reflecting total electrical activity of the ventricles. Prolonged QT interval can predispose to dangerous arrhythmias like torsades de pontis. Which rhythm is characterized by a sawtooth pattern of flutter waves on ECG? A. Atrial fibrillation. B. Atrial flutter. C. Ventricular tachycardia. D. Junctional rhythm. Correct answer B. Atrial flutter. Atrial flutter produces rapid regular atrial activity that appears as sawtooth shaped flutter waves, usually best seen in leads 2, 3 and AVF. The ventricles often conduct in a fixed ratio, such as 2:1 or 3:1. Which ECG pattern is associated with Wolff-Parkinson-White syndrome? A. Delta wave. B. Sawtooth waves. C. J-point elevation. D. Peaked P waves. Correct answer A. Delta wave. WPW syndrome is characterized by an accessory conduction pathway causing a slurred upstroke at the beginning of the QRS complex, known as the delta wave. It shortens the PR interval and widens the QRS. Which ECG wave represents atrial depolarization? A. P wave. B. QRS complex. C. T wave. D. U wave. Correct answer. Drop your answers in the comment section below. For downloading PDF content and for latest updates, follow our Telegram channel. I have given the link in the description below. If you like this video, don't forget to hit that like button. Thanks for watching.